Hello everyone, this is Dr. Demchenko, a sports doctor and osteopath. Today we are talking about the knee joint again. And we're going to talk about the patellofemoral joint, which is the joint between the kneecap and the femur. Here is the femur. In fact, here is our knee, very often, with high loads on the quadriceps. And in roller skating, the quadriceps is very strongly involved. The load is very large on it. It shortens and pulls on this tendon. As you can see, the cup is practically embedded in it. When he pulls hard on this tendon, the cup begins to press very hard against the joint, and there is increased friction. Nothing good. There will be inflammation, swelling and pain. How to deal with it? If you have pain in the anterior part of the knee joint, that is, if you roughly take the front half like this, then 80% of these pains are associated with the cup and with the quadriceps. Most often with the fact that it is clamped, shortened or just weak. Accordingly, in previous videos we showed how to stretch the quadriceps correctly. Today I wanted to show you so that you could do it yourself with your knee and quadriceps. First, the quadriceps, in addition to stretching, can be kneaded, and self-massage of the quadriceps can be very effective if it is done point by point. The most important point for relaxing the quadriceps is in the following place. If you take the kneecap, it has corners here. These, you can always feel them. And from this corner, go up the thigh, about 5 to 7 or 10 centimeters, depending on how long your thigh is. Along this line, start probing the points. If you have problems with clamping the head of the quadriceps externally, then along this line you will find a very, very painful point. Well, I have it right here. When you have found this painful point, you can simply insert your thumb quite intensively and start kneading it with such small circles. You should be in pain. Unfortunately, no pain, no gain. Accordingly, after 1.5 to 2 minutes of kneading, the point will stop hurting. In my practice, there have been very frequent cases when a person comes in with severe pain in the knee joint, bends badly, stretches badly, lies down. We massage the point for 1.5 minutes. One flexion extension. There is a rather intense click. Why is there a click? Because the glove stood askew due to muscle imbalance. After we massaged the muscle, it stopped pulling up the cup strongly. The cup is inserted into the right place with a click and the pain in the knee becomes dramatically less or even disappears altogether. Once again, at the extreme outer corner, go up 5 to 7 or 10 centimeters, depending on your hip, and look for a pain point. This is the first point that I would like to stretch. The second point is on the middle line. We take the hip, the middle line, and start probing along the middle line. Here, pain points can occur almost anywhere. For example, I have a very pronounced pain point here. This is the straight head of the quadriceps, which is responsible for the height of the standing cup, a very important head. Accordingly, there may be more than one such pain points. Very often they are closer to the groin. Very often they are somewhere here. Just the same, the lower third of the thigh, and all these points need to be massaged very well, for about 40 seconds to a minute until they stop hurting. This can, firstly, help you dramatically ease stretching. Secondly, it can help you with pain inside the knee joint. On the inside, painful points are less common, because the outer head of the quadriceps is more often overloaded and clamped. The inner part, on the contrary, is more often weak and underworking. Therefore, painful points are very rare here. So here we are looking for them. Only if you have any pain in this area. You just don't have to look. That is, the two main lines are the middle and the extreme on the patella. The following technique will be directly related to the movement of the knee pad itself. For this I will bear a little. Show you my knee. So it will be easier to find landmarks. So, here's the kneecap and we need to make it move well, rub less. To do this, we need to move it in a certain way. To do this, we sit on a chair, make an angle a little more than 90 degrees, Then with 2 thumbs, put 2 fingers on the extreme, on the edge of the patella from above and lower it down. That is, in fact, we do this kind of movement. And if you do it right, then what should happen? First, we shift the cup, not the skin. That is, if you move the skin, you will immediately see that your skin is moving, but at the same time the cup remains in place and nothing gets out here, under the cup. If you move the cup correctly, then, firstly, you can see how the cup itself moves down, and the second very correct sign is that there is a gough fat body under the cup, and this fat body goes out a little in different directions, like this. This is a sign that you are doing the procedure correctly. Also, if you do it correctly, you will feel some stretching of the muscles on the thigh. We are not doing this in order to stretch the thigh. We are doing this in order, firstly, to stretch the lateral restraints, such lateral ligaments that are on the sides of the patella. We stretch them, and in order to improve the sliding itself. This way the cartilage will feed better and slide better. When will we do such procedures? First, if you have pain under the knee, under the cup, or above the cup, that is, there are some unpleasant pains in this area. We will do this if you have tight mobility in the knee in the morning. That is, the person says, I need to warm up the first, 5 to 10 minutes. Instead of warming up, you can sit down in the morning. Do it like this 30 times and you won't have to warm up. In general, this is generally quite a useful event. Therefore, if you are experiencing heavy loads on the knee joint, then you can take and put your fingers and move the cup a little once a day, even at work, as a preventive measure, and it will improve the condition of your knee. A lot of people with an overloaded knee feel lightness in the knee after such a procedure. I hope you may not need this knowledge, then you will tell your friends, but if you have pain in your knee, then you will be able to help yourself. Thank you all for your attention. Dr. Demchenko was with you. Subscribe to the channel. Wait for the next releases. Bye everyone.